welcome to the stage Dr. Michelle Perro. Dr. Perro is a pioneer in the connection between human health and soil health. She's done some amazing things and has understandings of all this interconnectedness of what we are doing as farmers and how that ultimately affects the people who are eating the food that we produce. Listen to the passion in her voice, and you'll be amazed at what this medical doctor wants to do. We really enjoy having the opportunity to have a medical doctor on our stage every year, and we're so thankful that Dr. Perro could be here. Ultimately, as farmers, we want to do the right thing. We want to do what's best for the soil, but we also want to do what's best for our family and best for everyone else's family. So I think when you hear some of the insights that Dr. Perro is going to share with us, I think you as a farmer will want to do the right thing too. So listen in, buckle up, and be ready. Dr. Perro is going to share some things that will blow your mind.
Dr. Michelle Perro here today to talk TED-Med with you. Thank you to AgEmerge for having me share some of my ideas regarding bridging the divide, navigating the road between traditional and integrative medicine. So I think during this time of COVID, the COVID era, that the differences between integrative medicine and mainstream Western conventional traditional medicine have become more apparent. Vitamin C, vitamin D, steroids, you probably are now getting a lot of mixed messages regarding some of the treatments, and our worlds are beginning to collide a little bit. But should they? Should we have two separate worlds? How did we get here between this East-West divide? How do we bridge the gap between traditional or mainstream medicine and integrative medicine, which is what I do? So we're going to look a little bit at how we got there and with a historical lens. So let's start in medical school, shall we? Let's talk about how MDs arrive. Well, first you should know that pharmacology is a one-year course in medical school. It's taught around the second year. I've checked, that's when I had it 40 years ago. It's still being done that way. There is an information overload and proliferation of new drug information. Medical students are inundated with pharmacology, so much so that they are being instructed to learn fewer drugs and less about drugs. I'm going to share a study with you in a second. New guidelines are being introduced all the time about this and how much students should be learning, but nutritional education is not compulsory and not be included in part of the medical education. When I was a medical student, I got 2 hours of nutritional education. Some schools now give 2 weeks, but is that enough? We received something called the PDR, Physician's Desk Reference. I had to dig one up out from 2009 because now they're all online. I used to lift weights with this thing. And so here's a study which showed that indeed students are way overloaded with drugs, too much pharmacology, and they've limited it to 168 drugs. Why they got that much, I don't know. And a review about nutrition in medical education, which was published last year, showed horrific data on how little education, nutritional information people get, and to really understand and go over people's diets and nutrition with them in the office takes a long time. Most physicians in their practices get 10, 12, maybe 15 minutes on a visit. Is that enough to cover a diet history? So what happened? Well, big pharma, big money. The presence of pharmaceutical companies, although it's more tightly controlled, they are in medical education. They're bringing us food, they're bringing us donuts, indeed, and they were gifting us. That has changed over the years, but we used to get a lot of gifts from pharmaceutical companies. Oh, wasn't it so nice? They would feed us. Most of us were broke, and pharmaceutical reps, and they always looked so nice, would bring us food and studies and free pens. What a gift. Now, yes, but it's changing. That's changed in a lot of states. In California, the state where I'm from, we can only receive about $25 from pharmaceutical companies. I think it's something like that now. Okay, let's go on. So doctors, we are forced to adhere to something called clinical practice guidelines. And if we deviate from these CPGs, it's a red flag for medical review boards. And the last thing any of us want as physicians is to be flagged by the medical review board. It could be a long road when they flag you and expensive if you should need a lawyer. There is peer pressure not to think outside the box. They want us all thinking a certain way, practicing a certain way, and so we are restrained and contained. My husband's been trying to do that for me for about 30 years now. So, what's another problem? Well, let me share this study that came out of the Lancet. Lancet is a very well-regarded medical journal. It was regarding the accuracy of pharmaceutical advertisements in medical journals, fake facts, and what they said. Doctors should be cautious in the assessment of ads regarding drug safety, efficacy, or convenience, despite being in a reputable medical journal and or evidence-based. So the Lancet, reputable journal, as I mentioned, just came out with a study this summer. It was out 2 weeks, and then it was retracted. It was a study of 80,000 patients, which showed that hydroxychloroquine didn't work, and it got pulled out because it was fake news. And it seems that some of the people involved with that study were also manufacturing an antiviral drug, just saying. So these are some of the things we have to worry about. The New England Journal of Medicine, another very reputable journal, one of their editors stepped down some years ago, Dr. Marcia Engel, because of ethics in reporting and in studies. Another big issue for doctors, I'm just, again, laying the groundwork in our TED-Med of how we got here, is debt. The average medical student debt, check that number out. This was from last year, $201,490, according to the most recent data from the Association of American Medical Colleges. And when you add in student loans from undergrad, oh, look at that total. What does that number mean? Golden handcuffs. That young doc is going to be indebted to the system. She will get on the pill-pushing hamster wheel because when we treat that way, we can move patients quickly. But have no fear. There are organizations now to help this student in debt meet Dr. Debbie Debt there, and she's going to help young doctors navigate their way out of debt. It's very hard to navigate your way out of these huge amounts of money, and I am sure farmers probably know the situation rather well also, of what it's like when you're in debt. And then what else do we have to deal with? Takeover by medical insurance companies. And then during the Obama era in 2016, MDs, we were all forced to go to electronic health records, also called electronic medical records, which increased the time we had to spend non-compensated by 20%. So we have to spend 20% more time so we can justify those medical charts. We call them robo-charts. They're actually meaningless. So we can drop a bill at the end of our day, okay? And then patients are getting bills from insurance companies. We're dropping these bills. We have to spend hours, we don't have staff to call, trying to justify your bill. And I have on the phone have told insurance companies in the past who have denied patient tests or studies that they should give me their name because I'm putting their name down on the medical record as the provider since they have denied the procedure or the test that I had ordered. And that if there is a bad outcome, they should be sued right along with me. How about that? Oh, yeah. I have to get my own neurotransmitters in check. Okay, single payer health is not supported. Like the Bernie plan. How about Medicare? Medicare is an effective single payer insurance. So this is a pre-COVID photograph, and you can see what a waiting room might look like. And by the time we as clinicians see patients, they are so fed up with whatever nonsense they had to deal with the front office. Those patients in that waiting room look happy to you. Oh, not so much. And here's the medical system now, telemedicine, right? We're not in the offices. I'm doing telemedicine at home. And I'm diagnosing fractures and rashes. It's very creative, and this is what we're dealing with now, a bit impersonal. I like to see patients. I like to examine patients. Many patients report that their physicians never examine them. Frankly, sometimes physicians don't have time because we're on that wheel. Patients, our schedules are full. And last but not least, I would be remiss if I didn't share with you emails. Okay. And in some medical programs, we have to the end of 24 hours to respond to emails. So if I'd finish my day at 6 p.m. in my office in the clinic, I would have maybe anywhere from 1 to 20 emails to answer, from 1 sentence to 2-page dissertations on medical problems. So that too has added a new dimension to the MD kind of a layout, the milieu. So now you have an understanding what an MD life is like, how they were trained, what their lives are like, and the debt they hold. But did we start there? Did we little fresh, clean little med students and residents start there? No, we didn't. We started out with good intentions. We were good people with good intentions, wanting to provide top health care, idealistic. We were young and idealistic. But along the way, things got a little bit sidetracked. When the Merck manual first came out in 1899, it talked about all the things in the doctor's toolbox: herbs, homeopathics, natural remedies. That's how we started. There is still a Merck manual, and there is a patient form and a physician or a practitioner form still out there. It's changed a little bit since 1898, 1899. So what happened? Well, I'm going to tell you what happened. We know what happened. Rockefeller happened. I had to pick that picture because he looked a little fermented there for me, so I thought I'd share with you. He was an oil mogul. And what did he find? Drugs could be made from oil. And those drugs, if they're not from plants but from oil, could be patented. Yes, it's a patent parade. And who else is patenting their stuff? How about Impossible Foods? Oh, that Impossible Burger. You want to eat that GMO burger? Let me tell you, they have 100 patents cooking right now. They make money off patents. That's where the money is, follow the money. And so what he said is like, hey, he called his buddy, Abraham Flexner, who was the brother of the president of the Rockefeller Institute. He said, hey, let's transform medical education. Sent him on a journey across America, and they single-handedly, with the Flexner Report released in 1910, got rid of natural medicine and ushered in the age of pharmacology. That is what happened. At the turn of the 20th century, there were over 900 homeopaths practicing in San Francisco, and by the end of this period, they were all but essentially gone. That's indeed the true story. But we are returning to our roots, 5,000-year-old practice of acupuncture, effective, I refer patients to it as well, or acupressure, because kids don't like needles. So what do patients want? They want us to treat the whole person, the mind, the body, the spirit. They want to take part in their own care. They don't want a patriarchal, matriarchal, or hierarchical medical system which dictates to them what they should be doing. They are frustrated with the medical system. They want a kind of care that medical doctors are not trained to provide. So they butt up against this frustration. They have a desire for more natural treatments. They do not want to be on daily pharmaceuticals. Everybody wants to get off their pills. They want to reverse their chronic disease. Do you have a broken arm? Western medicine, fabulous. You have a chronic disease, an autoimmune disease, ulcerative colitis, diabetes, cancer, you want a more natural treatment. And then I want to talk about cost. But before I do, I've been focused on this kid, the vulnerable kid with chronic disease for decades, because now 54%, it's probably higher now, of American children have a chronic disease. And what is wrong with that picture? I rarely see kids that are healthy anymore. Kids are so unhealthy that parents think those diseases are normal, like allergies, like asthma, like food allergies, like eczema, like constipation. Oh, that's just normal. No, it's not normal. Kids shouldn't have any of those diseases. And I don't want to go into the specifics. I just want to give you an idea that it's affecting every single disorder. And my biggest screaming from the mountaintops is autism, autistic spectrum disorder. When I was a resident, a young buck, it was like 1 in 8,000. Now 1 in 23 boys has autism. Yes, and 1 in 58 kids. Boys to girls, it's around 4 to 1 now. Some of these stats have changed from this slide. This study is from 2016. So they're even within a couple of years, the numbers keep ticking up. So Harry Truman said, a nation is only as healthy as its children, and our children will not live as long as the parents. That is sobering. So let me explain. What's the difference between these integrative types of medicine? I want to explain to you. Holistic, functional, integrative. There are so many healing modalities, I get confused. And I tell when I teach, I say, listen, we as integrative practitioners learn a few, get familiar with a few, and know when to refer out. And I'm very familiar with the other forms, and I refer my patients because when you have chronic disease, it often takes more than one type of therapy to get you better. So let's cross the bridge. How do we do that? Definitions, conventional medicine. You guys know what this is. It's characterized by disorders by diagnosis, collection of symptoms. It does not seek the root cause, relies on pharmaceuticals, procedures, and surgery, and that's mainstream medicine. That's what we're dealing with. Now, the other types, there's a lot of overlap. They're all not in little boxes, okay? Holistic medicine, it's characterized by a focus on treatment of the mind, the body, the spirit, and a focus on interconnectedness. Naturopathic medicine, there are naturopaths, NDs, many Mary Ds, never heard of N Nancy Ds, and there are traditional naturopaths. They don't receive as much training. And naturopathic medicine emphasizes prevention and self-healing using natural therapies, honoring the body's inherent ability to heal itself. Integrative medicine, which is what I do, I integrate conventional and non-conventional medicine. I use antibiotics when needed, I use other drugs when needed, and try to get people off. And views the patient holistically and seeks the root cause. I'm always looking for the root cause, pediatric CSI right here. And functional medicine, I hate this word, but Jeff Bland came up with it. Some people consider him the founder of functional medicine. He wrote a book called Disease Delusion. You might want to check that out. And it's a personalized integrative approach, usually for folks from a conventional background, arching into root cause holistic medicine. There is an institute of functional medicine called IFM. So again, this is what we should be doing. How do we choose? How do you choose? Well, I'm going to give you some simple, quick ways to figure out how you go about this business of getting into integrative medicine. What kind of condition are we dealing with? Something simple or something more complex and chronic? Insurance versus out of pocket. Many integrative practitioners, whether you're dealing with an acupuncturist, a homeopath, a massage therapist, or a chiropractor, don't take traditional insurance, so you wind up paying twice. You pay your regular insurance, and then you pay your integrative practitioner, and sometimes that is not sustainable. So what do I say? Look for a holistic nutritionist. They're often trained in integrative medicine, they understand nutrition, and they're often more affordable. Right there, that's worth for you listening today. Okay, is it a legitimate practice? You know, I am not a supporter of green pharmacy. There are practitioners who are just substituting pharmaceuticals with, supplements like this kind of vitamin wheel. Oh, no, no, no. I'm not doing that either. We have to be thoughtful. I just don't want to give vitamins out as a substitute. That's just not good medicine, whether it's green or not. Location. If you really want to actually see on occasion your practitioner, but now with COVID and telemedicine, maybe not as important now. Plan. So this is what we're going to do. You choose a type of practice that resonates with you. Talk to your family, talk to family members. If something works for a family member, chances are it's going to work for you. The practitioner, all they are is the orchestra leader of your care. They create the umbrella, you do the heavy lifting. This is your plan. Choose a practitioner in your budget. These can get pricey. So you want to be able to sustain this. And if you're kind of working on a chronic problem, autoimmune disease, autism, you can think 1 to 3 years for treatment courses. It's not that quick. You think about it, you've had 10, 20, 30, 40 years to develop a disease. You're not going to reverse it in like 3 weeks. This is not drive-through McDonald's here, folks. It takes time. And I find it more effective if you work with an MD who's open-minded. Yes, they're hard to find. You will find one who can work with your practitioner so they can do a lot of the testing for you and offset some of the cost. That's how you do it. Remember, this is a marathon, not a sprint. We're going for the long haul. It's what I tell people all the time. This is not a short-term therapy. It's going to take us a while. Change is slow, and let's be persistent. Thank you for listening to our TED Med, Dr. Michelle Perro, my website, and thank you, AgEmerge.